Hello, I'm Judy Stiles. Thank you for joining us this week on Newsmakers. Well, medical care is a concern throughout the society as well as our community. Today we're focusing on Joplin and the community clinic of Joplin. Joining me with two guests, I guess we can both say executive directors at this point, Renee White and Stephanie Brady. Thank you for being here today.
Thank you.
Thank you.
I thought we better explain. We have the, I guess we can still officially be former executive director and the new executive director?
Yes, that's correct, Judy. I have been the executive director here at the community clinic since October of 2014. However, we are in a restructuring and transitioning area with the community clinic just recently and decided to devote the executive director position to be full-time. And thus we hired Stephanie Brady, who previously was at the Independent Living Center here in Joplin for the past 15 years. We're thrilled to have Stephanie on board as the executive director. I'll step away in another few weeks and move forward with my job here at Missouri Southern State University.
So Stephanie, you're very familiar with the Joplin community.
That's correct. I've been in nonprofit work in Joplin community for over 15 years, and before that I was in nonprofit work in New York City. So I love this community, and I love what our nonprofit agencies do to help people.
Did you find agencies collaborating oftentimes too, that you were aware of what the community clinic was doing due to your work there?
Definitely. I've worked a lot with, we've referred people back and forth to the clinic. Renee and I have actually worked together very closely after the tornado, both as in the long-term recovery committee. Renee was chair and I was the vice chair of that. So we had a lot of relationships built through there, and working with all of the different nonprofits in town through the long-term recovery committee was very impactful on me, and it made me want to get back more into more of a grassroots type of organization, which is what the community clinic is.
Great. Well, we'll start with some background for our viewers and reminding them you've been more than 20 years in Joplin Community Clinic. So
the community clinic really is the story, I think, of goodness and the heart of the Midwest, and specifically about Joplin. Two doctors here in town about 24 years ago, Dr. Mike Nagel and Dr. Charlie Bentledge, had really a Christian calling to do something for the uninsured people in Joplin. And they joined their two church families together to develop this idea of having a free clinic one night a week. That church family was the First Presbyterian Church and St. Philip's Episcopal Church. A lot of other churches then came in and surrounded and supported the effort as well. But from 1983 until 1990, we met one night a week. The community clinic kind of stood up like a MASH unit. We didn't have tents, but we put things together.
People came in and set up each time you had it.
Yes, absolutely. And that was every Thursday night. We were at the First Presbyterian Church outreach building, and we never knew if we were going to be there. We started at 4 o'clock, and we never knew if we'd be done at 7 p.m. or if we'd be done at 11 p.m. I was a volunteer back then. I volunteered for the first 8 years of the community clinic. I volunteered as a social worker, and it really has been one of my special times when I think about those early days in community clinic, as well as my early days as being a social worker. Yeah.
So these were people walking in. I mean, there was no advance appointment. They just walked in and said, I need help tonight.
That is exactly right, Judy. And that the community feel around the community clinic at 3:30, anybody that was in the building, we would hold hands and say a prayer and ask for God's blessing that we would do His work that night, that we would be, in some ways, the heart and hands of God that day. We'd unlock the door, and whoever walked in is who we served. Early in those days also, we had churches prepare meals, and so it was very ecumenical. We would sit down with the patients and have a meal and chat about, just get to know each other. And then once we were done with our meal, we would kind of perform the medical care that was needed. So some very beautiful memories when I think back to the early days of the community clinic.
So you have a lot of physicians, medical people who are really supportive of this operation, have been throughout the years.
That is correct. I mentioned Dr. Charlie Bentledge. He actually was one of the founders, and he still continues to come to the community clinic one night a month and offer his volunteer services to the clinic. We have a pharmacist as well that comes actually one day a week, and he's been doing that for 23 years, Chuck Elgin. And he gives us 8 hours a week of his volunteer time to make sure that the people we serve have the care they need.
Well, I understand you have a video that kind of gives us a quick little overview of the clinic. And so before we go too far into the nuts and bolts of operation, I'd like to share that with the audience so they can take a look kind of, I guess, behind the scenes as well. Here's some testimonials from people who are there. So let's pause at this point and let's take a look at our video.
The community clinic began when a group of local doctors saw a need to provide quality health care to the uninsured in our community.
Quite a few members from the community recognized the need for a clinic of this type and joined together. It was a slow start. We had a difficult time finding a place to have the clinic. Finally, the Board of Elders of the First Presbyterian Church agreed to let us use their multi-purpose building.
And from humble beginnings, the community clinic found a home and a mission.
Oh, it is certainly filling a niche that has been neglected. There's a whole population of people that do not have any health insurance, that don't qualify for government assistance, and these people sometimes are in desperate need of health care, and that's what this clinic does so well.
I think that the community clinic is the model for what healthcare should be on a local level. Instead of relying on some larger entity to tell us what we need, the community clinic evaluates what we need in our community and who we need to serve, and does a fabulous job in many areas of helping people in this community.
And still today, a group of dedicated physicians, dentists, nurses, and volunteers donate their time to promote a healthy community through faith, education, and treatment services.
Well, just like with anybody, it's life. Sometimes people, have a rough go of it for a while, whether they lose a job or just lose their insurance through their job and still have their job. But it's just about having that ability to have access for those people that kind of fall through the cracks sometimes and just don't have that ability to get the regular care that they may be able to get, any other way.
And as you retire, it's a good opportunity to continue with the knowledge that you have to help other people that need help here.
A mitzvah is a good deed without expectation of reward. So if you're going down there to say, I'm going to get a reward for it or whatever, I guess feeling good is a reward, but I look at that as my mitzvah.
The Community Clinic of Joplin, serving our community for more than 20 years.
So as we can see by the video, the physicians, the dentists, the people who are volunteering really seem to be getting something out of themselves as well. It's, they're helping others and feeling good about it.
It's easy to be done that way at the clinic. It's a place that really equalizes the community, and yes, we might be the providers of care, but we also sometimes receive care. Just last week we had a patient bring in a bountiful, plentiful load from his garden, many vegetables for us to have, and we set that out also. We took a few, but we also set it out for our other patients.
People come in.
And a second patient then received some of those garden vegetables, and he sang us 3 Christian songs in return for having the vegetables available to him, as well as the care we gave him. So very much there's a symbiotic role there, that we are both the givers and the receivers.
So you're helping in many different ways, not just the physical need of someone's care.
Yes.
It's a typical patient. I keep hearing the word the uninsured. Are there certain guidelines you go for, for people coming to the clinic to be patients?
Go ahead, Stephanie.
Our patients are uninsured. We don't receive any federal or state funding for any of the services that we provide. They're uninsured. We have individuals who are senior citizens who've fallen through the cracks of Medicare. We have, they may not apply or be eligible for Medicare yet because they're not at that age level, but they aren't having any other insurance at the time. Last week we saw a child whose parents moved from another state and their Missouri insurance wasn't effective yet. So that was another individual who fell through the cracks. There's a lot of people who, on a daily basis, more than I even anticipated whenever I came to the clinic, who really do fall through the medical and dental cracks, and that's the patient that we see. We see people who are working, who don't have insurance. We see people who are at that age where they have disabilities, but they don't qualify for Medicaid for whatever reason. It's just a wide variety of individual. There's no one category that says this is the individual that you would see at the clinic.
And as this world of insurance coverage continues to change, I imagine you're seeing those effects as well.
We are, Judy. And when the Affordable Care Act went into effect a few years back, we wondered if our clientele would be able to purchase and get into traditional health care. That really is one of our goals, is to help everybody find traditional health care, because we really are a stopgap measure. And unfortunately, the insurance exchange is probably out of reach even for our clients. Our clients are, in some ways, would be defined as the working poor.
Right.
We're talking about minimum wage or just over minimum wage. Most of them don't work 40 hours a week. That's about 65% of our population. The other 35% are really street people that are either living on the streets or in temporary shelters in organizations that we partner with, such as Children's Haven, Lafayette House, Souls Harbor, those type of places. But what we found with the changing landscape of healthcare is probably what would be best for our clientele is Missouri Medicaid expansion, which is really for the lowest of the low income population. And as of now, that's not passed through Missouri.
So you keep a good tracking of the situations or the cases for your patients, so you kind of get a feel for the trends and get a feel for the community that way.
Absolutely, and that's one of the wonderful things we have at the community clinic now, is we have a patient advocate or a social worker who really sits and builds relationships with each of our patients, and to really understand the complexity of their life, because it's really, as Stephanie described a couple of the patients that we serve, it's a complex world, and people don't fit into nice little boxes. None of us do, and some systems are just out of reach for people.
And then until you have to face that situation, I imagine a lot of patients don't know where to go, what to do.
Exactly, and that's what the beauty of having the patient advocate. She's able to sit down and get to know the individual beyond what their medical needs are, and she's able to help them make a plan for how they can get to their next step. So she's really very patient and very compassionate in what she does.
So if you were to kind of in general terms for the region, would you think that a lot of people would be surprised to find out how many uninsured people there actually are in our community? I mean, is it a larger percentage than most people would estimate?
Absolutely, Judy. I think in most regards, a lot of social problems that we have in America, I think most people think it's not in my backyard, it's not in my area. And so having people unable to access health care because they're uninsured, I think that would be quite a surprise. What our statistics show is around 18 to 20% of the population are uninsured. And I would hope that would be a startling number for people.
When they look at the size of the community and know how many people. Well, let's talk about some of the services. Of course, we saw doctors and dentists, but the types of things that people are coming to the clinic, for treatment and so forth. I guess you have general care to begin with?
Correct. We have general care. People can make appointments, but they can also drop in. So if, say that they wake up and they're not feeling well and they need to be seen, they can come in and be seen. Our dental care is, we prefer by appointment because our dentists are only there on certain days. We do have a breast clinic. We have diabetic clinics that meet 2 days a week. That's actually Mercy sends individuals over and they manage a diabetic clinic. We have chiropractor on our volunteer regs, and they come in and take care of a lot of needs as well. We do tooth extractions. That's our dental. Is we don't do any of the complex. It's primarily due to tooth extractions.
Pain relief for
exactly.
the teeth. Right.
But we try to meet the needs of the individual, and if it's beyond what our care is able to do, then we do work with them to refer them to appropriate care that they can get elsewhere.
So the person who wakes up some morning with the sore throat and really feeling lousy, but I have no place to go, they have an opportunity to come to you and say, I haven't, can I get some help?
Correct.
And tying that together.
And we're open just Monday through Thursday, but we have found that those are the days that people most frequent those opportunities of waking up and just feeling poorly. Again, without insurance, we would love to see anybody. We don't really have an income threshold or income limit, but we typically look at most people, once they make a certain dollar amount, they're able to move into the healthcare exchange. So we would love for people to, if they wonder if they would qualify, one is no insurance, and then 2, give us a call to find out if there's any other hiccups. We really only treat people in the state of Missouri, the counties in southwest Missouri.
That was my next question. You're in Joplin, so what areas do you serve? You know, you don't have to be a Joplin resident, but
No,
you
you
just
do
live
not.
on this side of the state line.
Yes, that's correct. That's correct.
Right.
We have patients, people that come and visit us from as far away as Berry and Lawrence County. Unfortunately, there used to be kind of a sister organization in Springfield like ourselves.
Right.
They recently closed and transitioned over to the university-based health system, and I'm not sure if it's up and running. So if you live in Monette, it's kind of a challenge to,
Which direction do I drive?
Exactly. So we'd love to see them come up to visit with us.
Now, you mentioned children earlier. What about pediatric care? Someone might have that child and they don't have that health insurance for their family and they're not qualifying for any state programs to help their children.
We have 4 dedicated pediatricians that come down every Wednesday morning. So one Wednesday a month, Dr. Prater, who was just on the video clip, she comes in. And so Wednesday morning has always been our dedicated pediatrician. Now, if someone has a child that's sick on a Monday, Tuesday, or Thursday, please give us a call. A lot of our adult doctors will do some basic work if needed.
What about when it comes to immunizations for children? We hear, school's coming up in the fall and everybody says you have to get those immunizations for children. Do you help with those types of services or refer them to places? How do they do that?
Actually, we'd like to not duplicate anything that's out in the community. And so we know that both the city and county health departments will do the immunizations. So we do make referrals out to that. One of the things that we've done in a pinch is the physical exams for sports. And so if, again, if a child has no insurance, wants to play a sport, please bring that child to us and we'll do the form and get that. We really want to.
They have to have that done before they can even start practicing.
Exactly, and we don't want to be, we value so much all of those healthy activities that families and children do that we don't want to be a impediment to that, so we will help with the physical exam.
We do offer our flu shots as well.
Oh, okay. So during the season when the flu shots are being administered, people can get those there as well.
Yes.
You mentioned some of the clinics or the programs. Sounds like you do some wellness or prevention type services then for people, educational outreach as well. Tell me about some of that.
And most of that educational outreach is through Mercy, and they bring that into our clinic. We provide the space for them, and we get them referrals for that. And they do a lot with diabetic education. They talk to them, the participants, about healthy lifestyles. They talk to them about cooking and their general management of their diabetes.
So going beyond just the treatment of diabetes with perhaps insulin, but what more can you do in your life and what other services are out there for you?
Correct.
We've learned a lot, I think, probably in the last 10 years, the medical community, about behavioral remedies to lifestyle changes and behavioral remedies to some of those diagnoses. So obesity is one of those diagnoses, as well as diabetes, some of the heart diagnoses, that if we can change lifestyle habits and behavioral habits, it's much more effective than just strictly the medication.
Don't just treat the problem, try to take a bigger picture.
Absolutely. And so in some ways what Mercy Hospital does is the education, but we also have some incentives, if you will. So we do have some glucometer machines. We have some things that as you come and participate in the group education, there are those incentives. Oftentimes, again, we have fresh fruit and vegetables in the clinic, and so that's an incentive. It's very expensive to eat healthy in Southwest Missouri, and so we wanted to be a part of those solutions, not just asking someone to make an overhaul in their life, but how can we make incentives or
they
support
start the few
that.
steps to get started.
Yes, and then the ball kind of rolls, hopefully. Yes.
Well, we hear a lot about every once in a while there's a community-wide health assessment. We hear of coalitions and so forth looking at how do you try to assess the needs of the community? I mean, we've heard in the past that heart disease and diabetes are big concerns. How does that all tie into health assessment for the community and what you're doing?
That is an excellent question, Judy, and I'm going to take one piece of that, and then I think Stephanie can talk about a new initiative in town. For about the last 20 years, the Jasper Newton Health Collaborative, and we've been partners of that collaborative, we do an assessment every 3 years. And so the Health Collaborative right now is actually analyzing deep level of data that has been transmitted by the state, collected by a variety of sources. And so we are just in the midst in Jasper and Newton County to really nail down what are our health priorities. The community clinic, we will support any of those efforts, always in the lens of for the uninsured. An example, though, that I recently came across back at the New Year was there is not a smoking cessation course in Joplin anymore. So I had 3 or 4 people call the community clinic. They want to quit smoking, yay. And I certainly wanted to do, kind of best practices, and really the best practice is some type of support, some accountability, as well as some incentives again. Right. And as I called around town, no one is doing smoking cessation classes. So we've made a commitment at the clinic that that's something that we want to offer. We want to make that available, and we want to make that available for all people, and ideally for free. Because that would be that we don't want any barrier for once somebody smoking.
More of an incentive if it's not going to cost you.
Exactly, yeah. And now Stephanie might want to speak about One Joplin, which is a new initiative that we're involved with.
We're both involved in the One Joplin initiative, and the clinic is very involved in that as well. And with the One Joplin Health team, which we're on, focuses on those health initiatives that we see through the community health assessment as important. And what our One Joplin team is trying to do is partner with that Jasper-Newton County Health Collaborative so that we can address those needs in a larger capacity. We have lots of people throughout all different regions of the Joplin community or nonprofit community who are working towards healthy outcomes, and that's what we're looking to do with the One Joplin team. And smoking cessation and diabetes and cardiovascular health, those are all those areas that we're really trying to focus some projects on.
So those are some of your key concerns, the
Exactly.
smoking and the overweight and those types of things we hear about in our society. And it sounds like it really is indeed a team effort then.
Definitely.
Absolutely. One of the other just kind of layers that we have found through this One Joplin initiative is there are barriers to living well and taking care of yourself well. And obviously the community clinic, we know one barrier is not having insurance. But one of the other things that we're kind of scratching at right now is the whole idea of transportation in Joplin. And the city has come on board with us in this conversation. But the idea that you might have an appointment with us, it's 7th and Joplin, and then we ask you to go to the hospital to do something.
That's on the other side of town. Yeah.
Exactly, a 3-mile trek. And for us who own a car, that's no big deal. You jump in your car and you do it. But for people who are living on the streets or people who are without vehicles, that can be another day, a full day of them being off work to get their needs
Arrange
met.
for somebody to give them a ride or whatever it takes to get there.
Absolutely. And so we're kind of looking at, when we talk about a healthy community, it's also those secondary things that impact people's ability to stay healthy. And transportation seems to be one of those.
Right, and tying our community together. Well, you've talked a lot about avoiding duplication of services, so keeping in touch with the other nonprofits as they develop programs. I mentioned you have, regular contacts, certain ones offer certain services, so that networking among nonprofits is important.
Very important, absolutely.
And that's part of what I think One Joplin does as well, is since we're all health-related organizations, we do talk about here's what we're providing, here's what services that we offer, and we communicate with each other to try to ensure that we're not duplicating services, but that also when we do see a gap, that maybe we can brainstorm and come up with some solutions.
Here's this need, and you're not doing it, I'm not doing it, how can we get it done? And tying that together. Well, a question comes to mind as far as financial support for the clinic. People are wondering, well, they're doing all these great services, how do they afford to do it?
A wing and a prayer. Since the beginning, we have a large support from the faith community. We have churches that give us funding every single month, and they've done that since 1993. So very thankful for those contributors. Yes. We also receive support from the 2 main hospitals. Mercy and Freeman have offered us support, as well as they give us donated services. We have a grant writer, and then we also do ask our patients if they can to donate, if they will. That's out in the lobby, and we just ask them if they've been blessed by us, that if they can give any monetary donation to bless the next patients, that we appreciate that. There goes the vegetables that we receive.
Pass it on and help others.
Yes, and so we've actually even received a printer from a patient. She said, I have no money, but I have a printer and no computer. Would you guys like my printer? And so it really is a beautiful place in our community where, again, pretty equalized. We're all there to help each other, and even as a giver, we are a receiver as well.
And as far as contributing, you mentioned like the printer, people contributing items that you need, the physical items needed to run a clinic. I guess even things from the gloves and so forth, those types of things are donated as well oftentimes?
We love to have that. In fact, one of the schools recently did a whole campaign to help us get hand sanitizers and Kleenexes. So very similar to what you take the first day of school. At the end of the school year, they said, let's do the same campaign and send it over to the community clinic. So we love to have those type of donations. We have a couple partnerships nationally that help us purchase reduced medications so that we can then offer medications to our patients for free. And so those are, we really do patch it together the best we can. Love to come and talk to any kind of civic group or any group to help them understand what we do. And then just recently the Rotary Club, the Noonday Rotary Club of Joplin held a golf tournament, and we were the recipient of $10,000 from them.
Need for volunteers? Stephanie, you're always looking for someone to come in and help. Maybe they're not medical related jobs, but do you need other types of volunteers as well?
Periodically we do need volunteers with, we've even needed volunteers for cleaning, and we have some office work that can be done. We do have on our website a page about volunteering. We have had some really great medical students that have come in and volunteered. So there's a lot of different opportunities for individuals or small groups that want to come in and help out.
You mentioned your website. Let's make sure people know where they can go. We have it up on the screen right now, joplinclinic.org, correct?
Yes, definitely.
So this will give you your hours. You mentioned Monday through Thursday, so if they need to know the specific hours, a phone number to call, and how to reach you. So forth. Well, what do you enjoy the most? I know, Renee, you've had a long history with the clinic. What have you enjoyed the most with it?
The lobby. I have a hard time sitting in my office and doing work because the lobby is the place of relationship and of community. We have a jigsaw puzzle table, we have coffee, we have water. Like I said, we have people bringing in vegetables and whatnot, and a man singing to us. So I love the fact that I get to be in other people's lives, and I receive as well as I give. And there's just really no regulations around it, no bureaucracy around it. It's really a pure social service agency, purely compassionate. And even when we can't help somebody, we're compassionate in helping them find the next place that can help them.
The answers to their questions somewhere else if they need to. So Stephanie, it really sounds like it truly is the word community kind of characterizes what you're doing.
Definitely. I've been extremely blessed. Every day I come to work and think, I really actually work here. This is really my job. And it's just such a positive place to be. And you just feel that appreciation from the patients, from the staff, from the volunteers. Everybody loves what they're doing, and it's just a good place to be.
Great. Well, I'd like to thank both of you for visiting today, sharing with our audience so they can learn some more about what you're doing and how things are going.
Thank you.
Thank you very much.
You're welcome. And I'd like to thank you, the viewers, for joining us this week on Newsmakers. I'm Judy Stiles. Hope you can join me again next week at the same time on this station. We'll see you then.